and thank you for watching this video on the impact of policy on occupational therapy by the North Carolina Occupational Therapy Association. First, we're going to discuss the relationship between policy, advocacy, and occupational therapy. And I want to start off by talking about this quote here by Marcia L. Finlayson. She says, "The ability to see what is possible and care enough to mobilize others for action is not limited to individuals with particular titles or job descriptions." And I think this is a great quote for occupational therapy practitioners because the advocacy is so inherent to the jobs that we do. And although advocate or lobbyist might not be our job title or within our job description, it's still really important that we participate in advocacy and cultivate self-advocacy in our clients. And in the introduction of the 4th edition of the Occupational Therapy Practice Framework, it's mentioned that the document, in addition to guiding OT practice, may also be used to be a useful tool in communicating with policymakers. And this is an early indication of the relationship between occupational therapy, policy, and advocacy. Advocacy is mentioned 29 times throughout the document, reinforcing its importance as an intervention and occupation for clients to engage in. And did you know that ACOTE actually requires that students who graduate from accredited programs should be prepared to engage in professional advocacy? We all know that OT school covers a lot of information in not a lot of time and not a great deal of depth. So more research needs to be completed regarding the implementation of health policy training in academic programs, but this is a requirement of graduates of accredited programs. Advocacy is really important for both the profession of occupational therapy and client engagement, as both of these arenas are heavily influenced by policy. And advocacy for both our clients and ourselves helps achieve the goals set by the triple and quadruple aims. The 3 goals of the triple aim are to improve the individual experience of care, improve the health of populations, and reduce the per capita costs of care for populations. The quadruple aim adds the experience of the provider to the goals of the triple aim. And so by engaging in advocacy at the daily practice level, the professional level, and the systems level, OT practitioners are working towards achieving these goals and improving outcomes for ourselves as professionals and our clients. And lastly, occupational therapy practitioners acting as change agents present the opportunity to strengthen our profession. Change agents are individuals who can influence others for the purpose of achieving a desired outcome. A phrase that I have been returning to when speaking with students and practitioners is, "If not you, then who?" Decisions regarding policy which affect occupational therapy, whether it's workplace policy or federal law, are always going to be made. It's our responsibility as OT practitioners to do our best to be a part of that policy-making process. To be a change agent, you don't have to set out to make a huge change. Even establishing a journal club or requesting training for an intervention technique can have large impacts. To be a change agent, you've just got to make a change, which will serve a meaningful purpose. So what is policy? Policy is so many things. It isn't only related to laws, and it isn't strictly political. Policy influences procedures and decision-making within institutions, whether that's the federal government or your local outpatient clinic. Policy impacts everyday practice, even if it may not seem like it. Laws and regulations influence occupational therapy practice from the services OT practitioners are able to provide to the size of your clinic sign. Ultimately, it's incredibly important for occupational therapy practitioners to be tuned into policy so that they are not caught off guard by the impacts it has on them and their clients. And to continue on, policy can be proactively developed to prevent a circumstance from happening, or it can be developed as a reaction to a set of circumstances. Policy is really important because this helps us understand how to carry out procedures and lets us know our role and what needs to be done within an organization. Policies are really important outlines which can be used to guide decision-making processes and create standard practice which everybody can participate in. And at the federal level, they are being created to advance democracy, understand human rights, and promote understanding between the United States and other countries. Policies that call to action can eventually create bills and eventually turn into laws. Policy plays an important role in guiding decision-making at all levels in occupational therapy. Research provides occupational therapy practitioners with evidence to support their claims and steer the development of new policies. Being able to provide evidence to support our profession gives occupational therapy practitioners a huge advantage when speaking with policymakers. And as an individual, you can take steps to increase your understanding of policy and participate in advocacy initiatives with various organizations. It's also to remember that although engaging in advocacy might feel intimidating if you're not familiar with it, it's more important that you show up than wait until a time when you think you'll know everything. When you are engaging with policy and speaking with policymakers, it's good to have an idea of what you're talking about, but you definitely don't need to know everything. Being able to tell somebody that you don't know and that you'll get back to them with further information is totally okay. At the organizational level, both the American Occupational Therapy Association and state associations such as NCOTA have lobbyists and volunteers that help advocate for the profession's needs and can and should definitely be used as a resource. The North Carolina Occupational Therapy Association and AOTA both facilitate advocacy days. AOTA does at the federal government level and NCOTA does at the state level. And organizations can also work together for policy changes. Coalition building is very important when trying to enact policy change, and NCOTA often works with the North Carolina Board of Occupational Therapy to work on rules, which resulted in supervision rules recently being changed. And in the community, volunteering, becoming involved with a cause that's important to you, helping with public comments are all ways for you to be engaged in advocacy. And one way that NCOTA did this within the community was to provide public comments during the start of the COVID-19 pandemic to secure sanitation stations for individuals experiencing homelessness so that they could also engage in hygiene and avoid getting or spreading COVID-19. Sometimes it might feel like when you're thinking about policy and advocacy that it only occurs at the federal government level or those places where it seems really scary and important, but it occurs at micro and macro systems. So at the micro level, healthcare infrastructure includes the physical environment, employee ratios, the budget of an organization, and the training budget as well. The consumer or employee opinions regarding policy are important to have an effect on changing that policy. Also, the consumer and employees can really take charge in being a part of policy change, since they are the people who are most affected by the policies. And hopefully at the microsystem, you've got leadership who are willing to listen to consumers and employees and address change. And then additionally, within the microsystem, you can see individuals participating in research or the organization as a whole doing research to get that evidence to back up policy. And at the macro level, we're talking about public awareness of policy and needs and looking at a much greater number of people. Policy works alongside healthcare standards, accreditation, and insurance factors. The healthcare infrastructure at the macro level includes federal funding, federal policies, and initiatives. So again, it's much bigger than a local hospital, which relies on funding from billing and such. Policy at the macro level is influenced by societal trends and can also impact societal trends. And at this level as well, there is federal research going on, or folks can apply for grants so that that research can be used for the greater good to influence policy. Policy is really important. Policy can be used to ensure accountability, which will therefore create better organizations, communities, and growths. And this can be done by making outlines that will ensure best practice, establish procedures, and give clarity and understanding so that people can refer to these policies in order to understand what needs to be done, or if something isn't being done right, what's the next step that they should take. Policy also provides guidelines to review that will help make changes. If a policy states something that we know isn't evidence-based, we can work on conducting research and also talk to policymakers to demonstrate the need for that change. We can definitely be the catalyst for change. And without the outlines of policy, it would be really difficult to create changes. Once you have a policy in place and you can see that, you can definitely look at it more critically and see, oh, is this working as it is, or would it benefit from something being changed? And then lastly, health policy addresses guidelines and standard practice through engagement with stakeholders and research to create new measures, outlines, and standards of practice. Policy literacy and understanding of policy helps with influence and engagement with other stakeholders, legislature, and creating bills. And we are going to get into developing policy influence on our next slide. So, health policy consists of the decisions, plans, and actions that are made and taken to achieve a society's specific healthcare goals. And as occupational therapy practitioners, we want to develop policy influence so that we can be a part of that policy making process. And in order to act as change agents in these processes, occupational therapy practitioners must be aware of and knowledgeable about the process of influencing policymakers, which will hopefully develop and support policies which will benefit occupational therapy. Developing policy influence is a process which begins with policy literacy, meaning the ability to identify and understand policy based on policy information. If you don't already consider yourself policy literate, by watching this video today and looking into courses about policy, you are taking steps to develop that literacy. Additionally, when you're reading documents, you can ask yourself a few questions to gain a better understanding of what you're reading. These questions may include: when did the policy process begin? What problem is this policy addressing? Who are the stakeholders of this policy? Or how many people are going to be affected by this policy? After policy literacy, there's policy acumen, which is the ability to analyze policies and the effects that they have. Following policy acumen, you then have policy competence, which is when you're able to take your understanding of policy and apply it. This could be in the workplace or at the state and federal governmental levels. And by applying your understanding of policy, that could mean making policies that positively influence your organization or responding to changing policies. And then lastly, we have policy influence, which is what we're trying to achieve. Once policy influence has been achieved, occupational therapies are consulting policymakers while legislation and other policies are being developed, implemented, and evaluated. So, as I mentioned, we definitely want to get to that level so that we are seen as important people in that decision-making process and have a seat at that table. Thank you so much for watching this video about the impact of policy on occupational therapy. If you have got any questions, please feel free to reach out to ncotaadvocacy@gmail.com, and please feel free to visit the NCOTA website for more information on advocacy, how to become a member if you're not already, and other events that we have going on. Thank you so much.